Hello, my name is Michael Stewie, and I'm a fourth year pharmacy student at Drake University in Des Moines, Iowa. Today we're going to discuss Lokelma, which is an antidote for chronic hyperkalemia. In this presentation, we will discuss a brief background of hyperkalemia. So we'll take a look at what is hyperkalemia, we'll look at some complications of hyperkalemia, and treatment options for hyperkalemia. More specifically, we'll look at Lokelma, a specific agent for hyperkalemia. So we'll take a look at its mechanism of action, its indications, its proper dosing, any adverse drug reactions, its warnings and precautions, and any important drug interactions. Now you may be asking yourself, what is hyperkalemia? Hyperkalemia can be diagnosed with serum potassium levels greater than or equal to 5.5 milliequivalents per liter. More specifically, if a patient's serum potassium levels are between 5.5 and 5.9, they'd be considered to have mild hyperkalemia. If a patient's serum potassium levels are between 6 and 6.4, they'd be considered to have moderate hyperkalemia. And if the patient's serum potassium levels are greater than or equal to 6.5, they'd be considered to have severe hyperkalemia. Hyperkalemia is most commonly found in patients who have chronic kidney disease, diabetes, or any type of cardiovascular disease. It's most commonly caused by impaired renal function or inhibition of the renin-angiotensin-aldosterone system. It's rarely due to high potassium intake. With that being said, hyperkalemia can cause some severe complications. Hyperkalemia can cause electrophysiological disturbances that can affect cardiac function. When the cardiac function is disturbed, it can cause the patient to develop an arrhythmia, ventricular fibrillation, asystole, or even cardiac arrest. We also can see some skeletal muscle weakness form, and if left untreated, severe hyperkalemia can lead to sudden cardiac death syndrome. So, how do we treat hyperkalemia? Hyperkalemia can be treated in two different directions. When a patient originally is seen to have hyperkalemia, we would typically treat them with 3 drugs, and those 3 drugs are calcium gluconate, insulin, and dextrose. The calcium gluconate is to stabilize the heart, the insulin is to push the potassium back into the cells, and the dextrose is to use to prevent the patient from going hypoglycemic. There are 3 other options for chronic hyperkalemia, which are Lokelma, K-Exalate, and the Veltasa. Since we'll discuss Lokelma further in this presentation, we'll just briefly discuss the other 2 options for chronic hyperkalemia. The first is K-Exalate. That has an onset of action which is pretty variable and can depend on the patient. It can typically be seen to take hours or even days, and the Veltasa can have an onset of action of around 7 hours. So as you can see, those 2 agents can take quite a long time to see effects, which is why we would administer the acute treatment to prevent the patient from having complications originally. Now we can dive deeper into Lokelma more specifically. Lokelma's generic medication name is sodium zirconium cyclosilicate. Lokelma has an onset of action of about an hour, so between the 3 agents used for hyperkalemia, Lokelma has the fastest onset of action. When we talk about its absorption, Lokelma is not systemically absorbed. That's important to note when we have a patient who is pregnant or who is breastfeeding. Since it's not systemically absorbed, we don't have to worry about the medication getting into the fetus or it getting into the breast milk. Lokelma is excreted from the body through the feces as well. So, how does Lokelma work? We'll take a look at its mechanism of action. Lokelma is a potassium binder that preferentially exchanges potassium for hydrogen and sodium. Binding of potassium reduces the concentration of the free potassium in the gastrointestinal lumen, which then there lowers serum potassium levels. Now, how would we use it? Lokelma has 2 different indications. It has a labeled indication and an off-label indication. The labeled indication is for chronic hyperkalemia. When we use it, we would see a reduce in high potassium concentrations. It can maintain normal serum potassium concentrations, and we would see a greater reduction in the serum potassium levels if the baseline potassium concentrations were very high to begin with. The off-label indication is for severe or emergent hyperkalemia, which has a level of evidence of a C and a G. When we discuss C, that means it's evidence from observational studies, so basically it's any estimate of its effect is truly uncertain. When we talk about the G level of evidence, that means that its use has been substantiated by inclusion in at least one evidence-based clinical practice guideline. We will typically not use Lokelma as an emergency treatment for life-threatening hyperkalemia because it does have a delayed onset of action, so that is when you would pair the use of Lokelma with the acute treatment options. If we were to use it for chronic hyperkalemia, there is a pretty specific dosing schedule we would like to follow. We would start the patient off on an initial dose of 10 grams 3 times a day for up to 48 hours, and we would follow that by 10 grams once daily. You can adjust that dose by 5 grams daily at about 1 week intervals just as needed. The usual dosage range for maintenance is 5 grams once every other day to 15 grams once daily. The maximum maintenance dose is 15 grams per day. If you were to use it for severe or emergent hyperkalemia, you would see the patient receiving 10 grams 3 times daily for up to 48 hours. In patients who have renal dysfunction, we would only have a dose change if they were receiving intermittent hemodialysis, and what that means is that the patient is receiving hemodialysis 3 times a week. So that person would be start on initial dose of 5 grams once daily on their non-dialysis days, and their maintenance dose could be between 5 to 15 grams once a day on non-dialysis days. As for any drug, Lokelma can have some adverse drug reactions that we would like to be aware of. The first one is any cardiovascular drug reaction, and that can be caused by edema. And the second thing we can see is endocrine or metabolic reactions, and that's typically seen to be caused by hypokalemia from Lokelma. In addition to Lokelma's adverse drug reactions, it's important to take into consideration the warnings and precautions before prescribing it to a patient. The first thing we want to take into consideration is if the patient has any gastrointestinal motility disorders. We want to take this under consideration because remember, as we mentioned before, Lokelma causes potassium to be excreted in the feces. If the patient has a difficult time having bowel movements, that patient will be unable to properly eliminate the potassium from the body. Therefore, we want to avoid Lokelma in patients who have severe constipation, any form of obstruction or impaction, or if they are experiencing any type of abnormal post-operative bowel motility disorders. The next consideration we want to identify is if the patient is receiving intermittent hemodialysis. This patient population will require a change in dose as discussed previously in this presentation. Some dosage form specific issues is that in every 5-gram dose of Lokelma, it also contains about 400 milligrams of sodium. We don't want to cause the patient to have hypernatremia. Finally, we want to be cautious using this in patients that require abdominal x-rays. This is because Lokelma exhibits radiopaque properties. Radiopaque objects block radiation rather than allow it to pass through. In comparison to Lokelma's adverse drug reactions and its warnings and precautions, we also want to look into the important drug interactions that may be caused. Lokelma has 3 main drug interactions, and the drugs are the clopidogrel, dabigatran, and warfarin. Those 3 medications are typically used in patients with heart disease or cardiovascular disease. And remember that hyperkalemia is typically caused by cardiovascular diseases. So patients who are going to require the use of Lokelma may also be using one of these 3 medications. So Lokelma decreases serum concentrations of dabigatran and the active metabolite of clopidogrel. Inversely, Lokelma increases serum concentrations of warfarin. So we want to make sure that we are dosing the Lokelma appropriately as well as the other medications the patient may be taking with it. Now that we went over the specifics of Lokelma, let's talk about some final thoughts. Overall, Lokelma is very well tolerated with minimal side effects, and it has been seen to be very effective. One downside to the medication is it can be very expensive. However, the nice thing is it's not the only medication option to treat hyperkalemia. So even though it may be expensive, there is other options that we could try in patients that may be cheaper. Thank you for taking the time to listen to my presentation on Lokelma, an antidote for chronic hyperkalemia. If you learned something in this video, please like and subscribe to this YouTube channel.